Right. So one of the major challenges that you are having is that whatever you are doing, why you are in this webinar, you're in this webinar because you have already lost a lot of money pushing or going for 10,000 different kinds of solutions, different kinds of medicine. Whosoever told you, whatever he has told you, you have gone there. You have gone to homeopathy, you have gone to Ayurveda, you have gone to different kinds of allopathic and diet related treatments, and basically done a lot of sacrifices in terms of you have left this, you have left that, you don't eat this, you don't do this, and you don't even enjoy the kind of in the way you would want different kinds of social gatherings also. So there is a lot of sacrifice. And unfortunately, you have come to believe in your system at the end of the day, it is going to take hell of a lot of time. Even if there is a right solution, it will take 4 months, 10 months, 20 months, 2 years, yes or no. And the reversal still is not going to be certain. This is exactly what you believe, yes or no. Now, today we are going to understand why none of this is true. You don't have to do either of those things. At the end of the day, you don't have to be getting into a complex way to solve it. It's simple, it's systematic, it is process driven, and it requires different skill sets to come together to enable you to come out of your conditions. So it has to be rapid, it has to be safe, and it has to be sustainable and without too many sacrifices for a prolonged period, right? So all of this we can manage, all of this we can do, and there is absolutely no one better than uh, Dr. Gaurang Rapesh to help us in this journey. So I'm very happy and proud to share this space with Dr. Gaurang. So a little bit about Dr. Gaurang. Dr. Gaurang comes from an allopathic background. So he's an MBBS, he is an MS, he is a surgeon. He has worked most of his professional life in different kinds of gastrointestinal surgeries. So all kinds of patients that he has seen across his professional life, and over a period he has realized there are many things that we are going in the wrong direction. So he's also being a researcher by nature. He researched and he compiled together many different courses that he has learned from and many different methods from ancient wisdom and otherwise. He's compiled together his own protocol and a systematic way in which we can come out of these chronic conditions, all of them. So we are talking about GERD, we are talking about IBD, we are talking about IBS, we are talking about gastritis, we are talking about mental health issues alongside and many other autoimmune conditions as well, right? So all of this is there. He has worked across countries. He has worked across, I mean, obviously across the nation. He has looked into more than 2,000 patients with this integrative method and delivered wonderful results. So without any further ado, I would like to welcome Dr. Gaurang. Over to you, sir.
Thank you, Ayush, for such a wonderful introduction. Shall I share my screen?
Yeah, you can share your screen. If you want, I would share the screen if you like to.
I can
share.
I'll share my screen.
Okay. Sir, as I said, the session is not in Hindi at all. This is completely English. So somebody who is not comfortable, I don't think so it is going to help you. You can probably leave the session.
Yeah.
Yes, sir, visible. Please go ahead.
So, Ayush already gave a wonderful introduction. I would just like to start off with sharing how I got into all this. So I was doing surgical gastroenterology in Bangalore Medical College, where in Karnataka, it's one of the busy gastroenterology units. So we would see a lot of patients who would come with IBD, ulcerative colitis, Crohn's disease, and some long-standing IBS also. We knew that we are not hitting the bullet and I mean the target, and we are only treating symptomatically. But still, we are helpless. We don't have any other answers to these kind of diseases, and we would step by step increase the medicines. We would start on immunomodulators, then go to steroids, and then go to biologicals. And then, if that doesn't work, we again operate. We do a total colectomy, And after that, again, we would end up seeing patients having the same problems. And I felt we are not really, improving the quality of life. So when I passed out of college, out of the training in surgical gastroenterology and started practicing, uh, 50% of the patients in my OPD again were IBS patients. So then I felt that I should really have to go into the depth of what this is. And then I discovered functional medicine from Institute of Functional Medicine in US, and did a couple of training there and went into understanding more about the microbiome. So once I studied about the microbiome is when I really understood about how exactly uh, treating the gut disease, which also has a mental health impact, is really works. And then I did some additional training in various forms of integrative medicine, traditional medicine, and some therapeutic procedures. So right now, the problem is, if you can imagine a sink which the water is flowing and the sink is overflowing with water because the sink is blocked. So what we're trying to do is just treat the symptoms in chronic diseases. And we are not looking at switching off the tap. So, if you look at infectious diseases, that's what killed most of the people in the early 20th century. That time, our understanding of disease was different. We were looking at a single cause, we were trying to identify an infection, and we had a particular medicine which could treat the infection. And it did a great job. Even today, if you have an infection, medicines work very well. But the problem with chronic disease is it's not a single cause, and it doesn't turn out to be a single symptom. It is a multifactorial disease with so many different symptoms, and the entire body is interconnected. But we have segregated our body into different systems. We study only gastro. If I'm a gastroenterologist, I don't know anything else. I treat only the gut. So that's how we are not understanding how the system is interconnected. But the thing about our body is the whole body is interconnected. The organs are specific to its specific function, but all the organs communicate with each other, and we have other systems also interconnected and communicating with each other. So we need to understand this interconnectedness, and a lot of our traditional philosophies understand this. Ayurveda understands this, traditional Chinese medicine understands this, but right now we are in a situation where, with evidence, with scientific understanding, we are able to understand the interconnectedness. And that is a brief description about how we look at the body in functional medicine. So you might be thinking, like I said, you have done a lot of things to your illness, and you've visited so many doctors, and the body has been like this for so many years and it won't change. But what I have realized in the last 3 years of researching about the microbiome, understanding the gut-brain axis, and practicing it clinically is that if we if we do it in a particular process, like the way it is supposed to be done, and we understand the whole body's interconnectedness, then definitely all the chronic diseases are reversible. To give you a great example, today you see so many startups claiming about diabetes reversal, sugar fit and true and twin health and all that. But if you go to endocrinologist, nobody acknowledges that diabetes can be reversed. But I've seen so many patients getting reversed with so many metabolic diseases. The same applies to gut health. What we thought are irreversible diseases can all be controlled very well if we follow this. So today I would like to share with you all the 3 myths about the gut, which is not letting us heal, and which is why the conventional gastroenterology is failing to look at the gut. And I'll also share with you 5 secrets of the gut health, through which we will work on reversing the gut. So this is the gist of the gut for or this is for those of you who need introduction to the digestive system. It's not the stomach where the digestion starts, it's actually the mouth. So there is salivary amylase, the first enzyme which breaks down complex carbs, and this is where digestion starts. And then you have the esophagus and then the stomach. And stomach will break down other protein and carbs into simpler carbs and protein. But also, once it goes into the intestine, you have the bile acid from the gallbladder, and you have the pancreatic enzymes from the pancreas joining the small intestines. And this is where most of the food is digested and absorbed. And then you have the food passing through the colon, where most of the water gets absorbed, and you pass the remaining through the stools. So what we've discovered in the past 10 years is we had two major transformative paradigm shifts in medicine. First one was when we discovered antibiotics. So many diseases where people were dying were curable. The second great paradigm shift was when we discovered the DNA and RNA. And now I think we are in the third paradigm shift where we are understanding the epigenetics and we are also understanding the microbiome. Microbiome is the innermost layer of your intestines, which is filled with organisms. So we knew about this, but we never had a good test to identify it, because there are about 3,000 species of organisms in each person, and you cannot do a culture and grow it because the most dominant organism will grow. So now we like how you do PCR test for COVID, we can do a PCR test of your stool to see exactly the genetic data of your stool. So we can categorize what organisms are there, what type of organisms, and what quantity of those organisms are there. So now is in the last 10 years is when we have realized and understood what exactly the microbiome is. And now we have realized it's much more than just organisms. It has an impact throughout our body. So when this is disturbed, you end up having symptoms. Of course, when you have abdominal symptoms, we understand how it is with the gut. But because of the microbiome imbalances, the intestinal lining gets affected, and you end up having systemic problems. You end up having skin lesions, which actually the root cause can be the gut. You can have depression, anxiety, where, like Ayush said, the serotonin production is not happening properly in the gut. And you can have, you're not able to lose weight. You always feel tired. That's because of the toxins which are coming out of the microbes, which are entering the system and causing that problem. And you also have autoimmune diseases and nutritional deficiencies, because the imbalance there is not allowing you to absorb properly. So these are the spectrum of diseases which most of you have come to this workshop with. This may be the titles and the diagnosis we have given today, but the way you develop it, the way you express the symptoms and experience the symptoms can be, there can be a lot of common things going on between the diseases also. So why does the current right now our healthcare is excellent for acute problems. You have gastroenteritis, we are very good. You have surgical problem, you have a gallbladder stone or an appendix or a cancer, we can do a robotic surgery and fix it. But why aren't we able to fix these functional issues, these functional problems? That is a big question we need to answer today. So the first thing I would like to myth I would like to explain to you is, whenever we experience acid reflux, GERD, we always think it is because of increased stomach acid. So all of these diseases, GERD, hyperacidity, acid reflux, laryngopharyngeal reflux, functional dyspepsia, H. pylori problem, all of them are diagnosed and treated with the same tablet, which is an antacid. Okay, so that is a huge misconception we have, that all of them are normal. So that's because acid is absolutely required for our body to digest. So the stomach, you can have a pH of from between 2 to 4. But as you keep going down, it gets more and more alkaline, and rest of the intestines, it's not as acidic as this. And you also have a lower esophageal sphincter here, which is a muscle which prevents the content of the stomach to go up. And so the esophagus also, you don't have acid. Only the stomach lining is so strong that it can bear that kind of acidic environment. So we need to understand what is the difference between gastritis and GID. Gastritis means there is inflammation of the stomach. The inner lining of the stomach is affected. So you might be having an ulcer there, or you might have an erosion there. The bicarbonate layer covering the stomach is reduced, so your stomach becomes more sensitive. So the symptoms you experience is pain, discomfort in the upper abdomen, and especially after meals. And the most significant symptom is the pain and the burning sensation you have in the abdomen. But what is acid reflux? Acid reflux is when this content of the stomach goes up into the esophagus. Okay, this lower part of the esophagus is not functioning well, and you have the content going up into the esophagus, and you either have burning sensation in the heartburn, or you may experience symptoms in the mouth and the throat. So the problem is not the acid. The problem is that the acid is coming up. But you can also have both the problems together. You can have gastritis and GID together. That is when you need to treat gastritis. Then GID also will start improving. But when you don't have gastritis and you keep giving yourself antacids, that's when your other reasons for acid reflux are neglected. So these are the various reasons why you can have acid reflux without having gastritis. It can be because of stress. It can be because of H. pylori infections. H. pylori infections initially will not cause ulcers or severe gastritis. It can just present as reflux and then gradually become gastritis. Okay, and then your lifestyle and some of the tablets, especially the painkillers, can cause these problems. And using a lot of antacids can also cause reflux. And so, and some of the food intolerances also, you're not able to digest the food properly. Those issues can also cause so those issues can also cause reflux, and which we call it as functional dyspepsia. So, this functional dyspepsia can also be because the vagus nerve, which is the main nerve which is communicating from the brain to the gut, is not functioning well. And that happens because of stress, because of anxiety. You start experiencing dyspepsia, and this problem can again affect the vagus nerve, which will worsen your anxiety and your mental symptoms. So what is the current healthcare system doing for this problem? We are only treating with antacid. And we know that almost we know that almost 30 to 40% of the people don't respond to PPIs, but we haven't understood the disease properly. That is why we feel this is the only tool we have, and we keep using PPIs for all the patients. So what happens when you keep using PPI again and again? So first thing is, acid is absolutely required for absorbing a lot of nutrients, especially iron, B12. There's something called intrinsic factor in the stomach, which is required to absorb B12, folate, calcium, zinc. So we start experiencing nutritional deficiencies. And then we can have bacterial overgrowth. So when you eat you are eating food from the environment which has a lot of microbes, but the stomach acid is so powerful that it can make the entire food sterile. It will kill all the environmental bacteria what you're ingesting, and then a sterile liquid will pass into the intestines. So when you start suppressing your acid, then your bacteria which you take from the environment is not killed in the stomach, and that itself can cause infections and bacterial overgrowth. And eventually, this bacterial overgrowth will weaken the immune system, because 80% of your immune cells is in the circulation around the intestines. It's called the enteric circulation. That's where 70 to 80% of immune cells are there. And gradually, we increase the risk of developing cancer, metabolic syndrome, obesity, and all that. So because we are suppressing the stomach acid, you have bacterial overgrowth and you have maldigestion. That means the carbohydrates are not getting digested properly. So when the carbohydrates are not properly digested in the stomach, then the bacteria will start feeding this bacterial overgrowth will start eating this carbohydrate, and that starts producing gas in the intestine. And this gas, when it's produced in the initial part of the intestines, comes up to the stomach, and that's what you start burping. And that causes heartburn and GERD. And this gas will expand the intestines to an extent that the stomach doesn't have place to stay there. So that is also why you start getting reflux. So many people have seen that experience worsening of symptoms with PPI, that is antacid. But the problem is, when you have taken this medicine for a long time, you can't just randomly stop it. You need to look at a lot of other factors to properly wane it down. And I did not study that in gastroenterology. So most of the doctors don't know how to taper off PPI. We keep increasing the medicine when your symptoms are high. But when we have to taper off and reduce the medicines, most of us don't know how to do that. So how do we do that is, we have to look at the gastrin production which is happening, that can be measured in the blood. We need to see how long you have used it, and if you have any anatomic problems like a hiatal hernia and a Barrett's esophagus, or if the esophagus also has got affected. So all these things have to be considered before tapering off. And that itself takes about 2 to 3 months, which to do it. And finally, a huge problem is the H. pylori. So H. pylori is a bacteria. It's an ancient bacteria. Ever since humans started, H. pylori is existing since then. And this bacteria has learned to live in that kind of an acidic environment. Imagine being in a pH of 2 to 3 acidic environment. So this bacteria is something which will start multiplying. So it's absolutely there in the environment. You have 50% of the population have this bacteria, and it starts multiplying when the environment for it is ideal. When you have you're under stress, you're anxious, you've eaten a lot of junk food, you've had alcohol. So all these things create an environment for the H. pylori to start replicating and multiplying. And that starts affecting the inner lining of the stomach. So it starts reducing your acid production, and also it starts affecting the protective layer in your stomach. So that is why you start getting burning sensation, you start getting pain and nausea and bloating, and you're not able to digest properly. But when we give you antacid, you feel better, because the reflux stops. The acid stops affecting the esophagus. But then the H. pylori is finding an even better environment when you use antacids. So the multiplication starts even more. So that is why we need to find a proper treatment for H. pylori. So right now what we're doing is we're giving an antibiotic. So antibiotic is many times required for H. pylori, but we can't stop there. When you just kill the H. pylori organism and you forget about it, what happens is a small amount of H. pylori stays in your stomach, and that will start slowly multiplying if the environment is still ideal for it to multiply. So the important thing is that after taking H. pylori treatment, if you should not, many times many patients say that after H. pylori treatment I felt better, but slowly I started getting the symptoms. That's because you have created an environment for the H. pylori to replicate again, and we need to help the stomach repair itself, help the immune system, and also give your body nutrients so that the environment is not ideal for the H. pylori to come back again. Okay, and then you also have the gut brain axis signaling. So the vagus nerve is something which we thought is carrying signals from the brain to the gut. But today we have realized that we have 9 times more signals going from the gut to the brain, and a lot of these signals are actually mediated by the bacterial metabolites. So these bacteria, it can actually communicate with the nerves and make you feel, can play with your emotions. So that is about, that's the main reason where we are going wrong with GERD and reflux and gastritis. Next problem we are going wrong with is the constipation. So why exactly is constipation a big problem now? So if we always think, okay, we are constipated, you take more fiber. A large chunk of patients will become better with fiber, but there are more than 30 to 40% of the people who may not improve with fiber. And those are the patients who have other reasons for constipation. It's just not the diet which is responsible for the constipation. It may be the medications which you're using which is causing constipation, the stress and the environmental factors which has made the colon and the intestinal movement very slow. So that can also cause constipation. It can be secondary constipation because of other diseases, and it can be a problem in the pelvic floor. This is the pelvis, which is the bone in your hip joint. So there the muscles might have some issues which is contributing to the constipation. Also, there might be some anatomical problems of the rectum which is contributing to the constipation. So we need to really go deeper and understand what is the cause. So these are the medicines which we commonly use. We have allergy medicines, we have pain medicines, antidepressants, antipsychotic, psychiatry medicines. We have iron supplements, calcium supplements. We have BP medicines. All of these things can cause constipation. So another big reason is when we create an environment for these bacteria which produce methane gas. When we create an ideal environment for those bacteria, the methane actually interferes with the nervous system, enteric nervous system, and that causes reduced motility because of the inflammation. So we need to target the bacteria which is producing methane. Many times when we take a lot of fiber, for people who worsen after taking fiber food, that's because you're feeding the bacteria which produces methane. You are allowing the methane production because of the bacteria, and that will worsen the constipation. So we need to look at the secondary causes of constipation. Is it because of thyroid problem, because of diabetes, nutritional deficiencies, nerve-related problems, or hormonal problems? All of them can also cause constipation. And another big epidemic we have is the Western toilet. So this is a muscle which passes around the rectum and it's attached to the pubic bone in the front. So this is what supports the rectum, and in a normal time, even though your abdomen is filled with stools, it doesn't come out because of this muscle, because it's changing the angle between the rectum and the anus, and there's an acute angle between the rectum and the anus. And when we squat in an Indian toilet position, this acute angle will become less, and you can easily pass stools. But when you're in a Western toilet, the angle is not acute enough. The angle is still acute where the stools are not able to pass easily. So constantly you're spending more time in the toilet, but the stools are struggling to pass because there's not enough space, and that creates hemorrhoids, that creates fissure in that creates fistula in and also it can cause abscess formation. So just putting a stool in your commode and changing your position to an Indian toilet can solve the problem to many people. The third myth what we are facing in the world is that IBS is a psychosomatic condition. We have transitioned from an age where we can see all, in science we believe what you see only you believe. So when we do colonoscopy, we do an endoscopy, colonoscopy, scanning, ultrasound scan, CT scan, we see that there is no structural problem, there's no anatomical problem, and we say you don't have any problem. But the problem in IBS is the bacteria, which you cannot see in your naked eyes, you cannot see in a colonoscope, but it is seen at the microscopic level. So only now in the last 5 years we have these technology available to identify dysbiosis, bacterial imbalances, which is actually the cause for IBS. So that is why if many doctors, many patients are upset because when we are not able to see any structural problem, doctors say it's all in your mind, there is nothing wrong with you. And we have called it a functional somatic syndrome. IBS itself, if you look at the definition of IBS, doesn't have any meaning. It only means that you have particular symptoms. Irritable bowel syndrome means that you have either diarrhea or you have constipation. But what is causing the diarrhea, what is causing the constipation, it's clinically, it doesn't make sense for us. So many times these other problems, the lactose intolerance, food sensitivity, small intestinal bacterial overgrowth, parasite problems, a lot of stress, gluten intolerance, and non-gluten wheat intolerance also, and lack of exercises, celiac disease, magnesium deficiency, less fiber, fungal infection, gluten intolerance, all of this can be misdiagnosed as IBS. Because none of these diseases produce any structural changes in your gut, we call many times they're misdiagnosed as IBS. And unless you develop a complication or worsen, we are not diagnosing it. So that we need to understand that IBS has a definition, doesn't have any meaning. So IBS can have a lot of reasons. There can be food intolerances where you are not able to digest certain foods. Either your body doesn't have those enzymes to digest the food, or the bacterial imbalance is not allowing your body to digest the food, which is why you have temporary intolerance of food. You may have yeast overgrowth, where small intestines are supposed to be have less amount of organisms. But because of our lifestyle, our diet and all that, there is retrograde movement of bacteria from the colon into the intestines, and that can cause bacterial overgrowth, and especially the yeast overgrowth. So most of the time when you go to gastroenterology, we give you antibiotics. So antibiotics will take care of the bacteria, but the yeast, the fungus, is where will overgrow when the bacteria is suppressed, and that can still continue to cause problem. And many patients can have a low-grade bacterial problem. You have had a gastroenteritis once, and then you're not recovering fully from the gastroenteritis. It's not enough for you to go to hospital. If you do a stool culture, you might come out negative, but still you have some amount of infection which is still causing problem. Another major problem is you have reduced good bacteria. This is the biggest cause more than any other cause, because the problem in today's society is reduced good bacteria. We have revolutionized our agricultural industry by having a variety of pesticides and chemicals. But we forget that the same pesticides, when you have the residue, can actually impact our gut bacteria. The pesticides which kill the bugs in the plant can kill the bacteria in your gut. And that is why we are losing the good bacteria in today's world. As an epidemic, we are losing the good bacteria, foundational bacteria, and that can cause IBS. And sometimes there can be low-grade parasite worms, which may not get detected in any test, but it continues to create problem. And there are some, again, some lactobacillus strains and other strains which are also missing. So that is why we need to understand the microbiome to fight IBS and to treat IBS. This is the missing link in curing IBS. Unless we treat the microbiome, it will only be symptomatic treatment for IBS. And if you look at the microbiome, we actually have more bacterial genes in our body than our human genes. And we have more bacterial cells in the body than human cells. And imagine how much the bacteria might be interacting with our human cells. And the type of bacteria is also interacting with our genes, with our energy, with our hormones, and with our metabolism. So what affects the bacteria is it can be the genetics. So the mother's bacteria can also can affect the child's bacteria. In fact, the environment at which the child is born, if you compare a child born with vaginal delivery, where the child is exposed to the vagina of the mother, where vagina has a lot of bacteria, compared to a child born with cesarean section, where we do it in a sterile condition. We totally clean the abdomen, absolutely do it in the operation theater without any infections. And you see increased incidence of allergy in children who have born with cesarean section, because there is a missing bacteria which is in the microbiome of the vagina of the mother, and the baby doesn't get it. And then you have other environment like the pesticides I said, and the pollution around us. All of that is affecting the microbiome. And a diet, which most of our food is processed food, it doesn't feed the bacteria. What feeds the bacteria is fiber, and it is the plant nutrients. So when you don't have fiber and plant nutrients and phytonutrients, then the microbial diversity reduces. And our lifestyle is affecting the microbiome, hormones are affecting, and also the industry is affecting the microbiome. So, and microbiome is not just in the gut, it's also in the nose. A lot of allergies is actually a microbiome problem in the nose, that there is some yeast or there is a bacteria which is not fully recovered, and that keeps creating problem in your sinuses. Mouth has a lot of microbiome. The cavities you develop is because of the microbiome imbalance. Lungs have microbiome, and that's how in COVID we saw a lot of people having COVID were getting GI problems, because the lung microbiome interacts with the gut microbiome. And colon has the highest density of microbiome, and even the sexual organs, the vagina and the penis, have its own microbiome, which produces microbiome is responsible to maintain the pH of the vagina. And to prevent infections in the sexual organs, also you need healthy microbiome. And of course, skin is the biggest organ in our body, which also has the microbiome. So in our traditional system in Ayurveda and Osteopathy, you always hear the gut is the center of your health. What you eat will decide about your health. All those quotations make sense now, because the gut microbiome can either shape our body and our immune response, or it can predispose one to disease. So what happens when this microbe is imbalanced? So I told you the outer covering of the inner layer of the intestine. On top of that, you have the microbial layer. So once the microbial layer starts getting imbalanced and it starts producing toxins, it starts affecting this junction between the two cells in your intestine. And once this junction is affected, then you start absorbing food which is not supposed to get absorbed. When it's still bigger in size, it starts getting absorbed. And that creates problem in the immune system. It creates imbalance in the immune system. And that is how we start developing systemic diseases. That's the symptoms around the other parts of the body when the gut is affected. So all these are factors which I told you, which is causing dysbiosis, which alter the intestinal permeability. So imagine your skin is quite impermeable, but your intestine has to be permeable to the food, but it should be impermeable to the toxins and the unnecessary material. And once this permeability is affected, you start developing food allergies, sensitivities, intolerance. Your digestion is not good. Even though you're digesting some nutrients, it's not in a form that you can make use of the nutrient, and the toxins and the bacteria starts getting inside the body. And that is when we start developing the systemic disease. And again, the nervous system is closely linked to our intestinal lining and the immune system. So once these toxins get into the bloodstream, it also gets into the nerves, and the nerve motility worsens, and that's when you start developing diarrhea or constipation. So it's all interconnected. So that's why we call the gut has second brain, because it has so many nerve fibers that it actually can have its own cell signaling and nerve signaling pathways, and it can produce its own nerve conductions, and it doesn't have to be connected to the brain. It can actually function it can do some of the stuff independently. That's why it's called the second brain. And with the brain, this enteric nervous system is interconnected, and you have signals from both ways. That is why when you have mental symptoms and you have gut symptoms, you can't just treat the gut and wait for it to improve, or you can't just treat the mind and wait for the gut to improve. We have to do it simultaneously. And when we do it simultaneously, you get faster results. So that is why it's very important that if you're having gut issues, we should not actually overburden our body with more exercise. We should actually give the body enough rest. And that is more important than giving more stress to the body by exercising more. And finally, I would like to add a small note, because many of you were asking about ulcerative colitis and Crohn's disease in the beginning. So these two diseases are supposed to be the unsolvable autoimmunity diseases, where we say that it is incurable. But we see a lot of symptoms being shared with IBS and IBD. Of course, they are different. IBD and IBS are not the same. But if you look at the history of the patient who has IBD, most of them, it's not that you develop IBD overnight. Today you're sleeping, next time morning you wake up and you have IBD. That's never the situation. Every patient who has IBD has developed gut problems from at least 5 to 10 years. And these microbial imbalances, these digestive imbalances, gut motility issues, all of them are, when they are not treated enough, then the intestinal permeability keeps increasing, and the immune system is again and again triggered. And it reaches to a point where the immune system produces antibodies against our own cells. And that is when it starts affecting our inner lining of the gut, and we develop IBD. So broadly, if you have to categorize, ulcerative colitis starts from the rectum and then progresses upwards to occupy the entire colon. But in Crohn's disease, you have skip lesions. That is, you can have small lesions all across the small intestines and the large intestines. But the mechanism, there's a lot of similarities in the mechanism, even though the disease itself is categorized differently based on the histopathology on the microscopic studies. But the disease pathogenesis or the immune cells changes what happens have a lot of similarities. So that is why we always see that this microbiota is always affected in IBD people. All these factors, whether it's pregnancy, in the childhood exposure to toxins, genetics, drugs, environment, diet, all of them disrupt the microbe, which disrupts your intestinal permeability, then disrupting your immune system. So, as a consequences, you develop all the problems, the deficiencies, because you're not able to absorb fistulas as a process of the disease, and a lot of other systemic problems. Another thing which we never understood about IBD is extra-intestinal manifestation. So now we can clearly understand how you have extra intestine. Extra intestine is outside the intestine. You still have symptoms of IBD, like pyoderma gangrenosum, eye disorders, kidney diseases, liver diseases, joint pain, arthritis, and anxiety, depression. All of them are outside the intestines. And now, since we understand the link between the microbiota, the intestinal permeability, immune system getting affected by intestinal permeability, we understand how this is happening. So, like I said, we are only sticking to a diagnosis of what we see. So, all these diseases I mentioned to you many times will be, except IBD, all the other diseases which are categorized as functional diseases will be normal. Your scanning will be normal, your endoscopy is normal, colonoscopy is normal, blood tests are normal. And then the gastroenterologist says, oh, there's nothing wrong with you, just go home. But we need to shift our perspective of looking at this disease. These are functional disease. The problem is in the microbiota, the intestinal lining, and in the nervous system, and in the immune system and the hormonal system. So these functional problems cannot be seen in any scans. So what we use in functional medicine, we go beyond the ICD-10. ICD-10 is the classification of diseases we use in the hospitals, but we need to go beyond that. So we need to see the functions of the disease gut. So the 5 functions of the gut is it's helpful for digestion and absorption. We need to see how your digestion and absorption is impaired. Is your enzymes secreting properly, doing its job properly, and is it not having any side effects? Is your intestinal permeability intact? Is the lining of the intestines intact? Is your gut microbiota balanced? Is there any bad bacteria high, good bacteria low? Is your immune system triggered because of all of these things? And is your nervous system, which is the body is controlled with autonomic nervous system? That is, you don't have control over this. If the hand, the legs, and the muscles, you have control, but you don't have control on the heart. You don't have control on the gut. And this system of nerves, it's called the autonomic nervous system, and that has 2 broad categories: the parasympathetic and the sympathetic. And parasympathetic is what controls the gut. And when you're under stress, the sympathetic gets triggered and the parasympathetic gets suppressed. So we need to find this imbalance when we evaluate. So based on that evaluation, we need to make a plan. So we can't suppress the diseases. We need to support the body to balance itself. And we need to do that in a methodical manner. So again, you might be thinking that you don't want to take more medicine. You already have enough medicines. You have tried everything, and you've already seen a lot of doctors. But the thing about this approach is this is a process-driven approach. So we do step-by-step approach, like I said, dig in. We assess the gut based on its function, one by one. Based on detailed history, which we take and which we will ask you to fill a form also. And then we have to make a solution to optimize the gut based on the dysfunction of what is happening to your body. It's not a generic protocol. It's not something which everybody can follow, but it has to be made and planned based on the dysfunction in your system. And this system is a process-driven system. it involves certain process which has to be done step by step. And this process is what I want to share with you. So it's called the 5R approach of treating the chronic diseases. And first step is to reduce the factors which is causing problem. So it can be the food which is causing problem, the junk food, the oily food, the food intolerances. You need to reduce that food. You need to reduce the food which is feeding the bad bacteria, the high carb diet, the sugars, the processed refined sugars, which is feeding the bacteria, which is not allowing you to heal. You need to reduce that. And we need to reduce the bacteria which is causing problem. So it can, if it's the stomach, it can be the H. pylori. If it's lower in the intestines, it can be the other bacteria which can be causing problem. So we may have to use medicine sometimes, but many times we can use herbs and botanical antimicrobials to reduce the load of those bacteria. The next is we have to understand the digestive enzymes. So many times when there is bacterial problem, the digestive enzyme production is reduced. For that, we need to identify what is reduced and support it by supplementing those enzymes. If HCl is not functioning, we need to temporarily give your body HCl so that the food is digested properly and then it's not causing more problems in the intestines. So many times I've heard that patients have taken a lot of probiotics. They've tried so many medicines. It's not working. If you ask the doctors, even doctors say the probiotics don't work. That's because we need to go from north to south. If the microbiome has to become normal, you need to create an ideal environment for it to become normal. And unless that environment is created, the probiotics don't work. And that environment is created when the food is properly digested at the place it's supposed to get digested. So if undigested food is going into the intestine, then that is not creating an ideal environment for the microbiome to survive there. So that's why probiotics are not working. So we need to make sure that what is supposed to happen in the stomach happens and then goes in. So once that happens, your microbiome starts improving and recovering, and then you don't have to take these additional enzymes. The next problem is the lining of the gut. So for the lining of the gut, definitely a healthy diet, nutrients and all that will help. But when you're not absorbing what you're eating properly, then you're not giving the lining enough nutrients. So there are certain nutrients which will directly act on the lining of the gut and which is required for the lining of the gut to improve. For example, it is zinc and antioxidants like vitamin E, vitamin C, A, and you also have omega-3 fatty acids and some amino acids like L-glutamine. There are some plants also like aloe vera and slippery elm. So all of these will provide the nutrients for the inner lining of the gut to recover. The next step, after you remove what is causing problem, after you replace the enzymes and repair the gut, is then you start feeding the good bacteria. So that's when the good bacteria will start playing a role. Many ways to take. Initially, you may have to take a single probiotics, single strains of bacteria, which are well tolerated. Because many times what happens, the small intestine has a lot of imbalance happening. The bad bacteria, good bacteria, imbalance is there. And when you, on top of that, you try to take a supplement, you further worsen the problem. When you take a tablet with a lot of bacteria in it. So that is why once you do the first 3 steps and your tolerance improves, you need to start taking single bacteria. For example, Lactobacillus reuteri, Rhamnosus, Saccharomyces boulardii. These single bacteria are well tolerated, even in a problematic gut. And once you start tolerating that, we step by step add other broad spectrum probiotics. And finally, like I said, the vagus nerve, the nerve which connects the brain to the gut, has to be exercised. And the way you exercise it is by reducing stress, practicing breathing techniques, meditation, stress relaxation techniques, and also wherever the vagus nerve is supplied, the vagus nerve passes from the brain. It comes out of the brain from the skull itself, and through the body it goes to the gut. So wherever it's going, it's giving out branches. It gives out branches to your throat, to the posterior pharynx. It gives branches to the trachea, to the lungs, then to the diaphragm, and then to the abdomen. So all these things to exercise, you can do humming, you can do chanting to exercise your vocal cords and the posterior throat. You can do breathing exercises, relaxation techniques, diaphragmatic breathing to exercise the vagus nerve. So all of these techniques have to be done to gradually exercise the vagus nerve. So when you do it in a step-by-step manner, what do you achieve? So you have better moods, your hormones are balanced, more energy, you have less anxiety, less depression, you have better skin, and you have immune tolerance. You don't get seasonal allergies. So this is the gist of how we work with the. And I would now like to request Ayush to take over so that he can explain further about how we go about this whole approach.
So first things first, thank you, sir. First things first, we'll have all the questions, so don't go anywhere. So all of the questions would be taken in a sequence. So I mentioned in the group chat, please raise your hand so that we can organize this in an effective way, and everyone gets a chance. We are not going to leave until all questions are answered. So many of you would have the question about what is the program, what does it have, and what is the price of it? Yes or no? Do you want me to cover that? Because that is what we hope to cover. Right? Only one yes. Okay. So I'll just take 5-10 minutes to do that. And very quickly we'll move on to the questions, right? Because I'm sure all of you have a bunch of different questions. So this entire process of 5 hours is what we hope to cover, and we would like to cover in a 3-month process. This is the time period it takes. So what is required for this to be effective? We need to understand what is wrong with you, how it is wrong. We need certain tests, certain diagnostics. What are those tests? We'll discuss. We'll also discuss how would we know about you, etc. Then the next step is how is it going to get implemented? What are the kind of people? What are the kind of discussions? What is the kind of access we are going to get? And what exactly happens in the program? And finally, therefore, what is the price? So talking about a 3-month long treatment program, which can be taken from anywhere in the world. There are certain specific tests which also could be conducted from wherever, right? So all of this we'll discuss. We have lab partners and all that who can help you get those tests done or conducted locally as well. So you don't have to worry about those things. So this 3-month process, the main thing it has is, if you really want to break it down top down, is that there are 3 components. The treatment always obviously is going to be personalized. So everyone has a different 5-hour journey. Okay. The 5 hours that we talked about are going to be very, very different for all of you. There are different things which a GERD person or IBD or IBS or gastritis, etc. There are different methodologies, and so every one would be individually treated and discussed by Dr. Garang Ramesh. All right. So treatment is always going to be individualized. Second thing, there are a bunch of things that you would have to observe and make changes in your lifestyle. As you can understand, I hope the session was useful for you. Yes or no? Awesome. So there are a few yeses. So I hope others also who are not responding, the session was useful. So this education is critically important, because if somebody is asking you to do something and you're, blindly or, in a numb way, you are taking those medications and XYZ, whatever it is, at the end of the day, it may work or it may not work. But there is a core mental health element also, as we have discussed, and there are many things any which way you have to incorporate in your lifestyle. So it becomes much, 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 much easier when you understand the whys, hows, and how to's of whatever needs to be done. So for that, it is critically important that there is information which is of every single hour as we proceed. So there is every single piece of information reaches you directly from Dr. Gaurang Ramesh. So we do have educational sessions. Now this is very, very useful for people who are professionals also. Let's say doctors who want to or gastroenterologists, if they are there in this session, it will help you guys also a lot, so that you can probably incorporate more conditions and you can help your patients better. Third thing is, everyone is going to have certain struggles in implementation once in a while, and there are going to be benefits and developments for a lot of people and a lot of recoveries over a period. So all of this does help a lot when you are part of a community. Now this community is optional, you can be a part of it or not, but it is very, very important from our perspective that you remain a part of this, so that you get a lot of information which we want to share in general with all of you, and also you get to see the journeys of others as well. So this group would be managed or administered by Dr. Gaurang Ramesh and the entire medical staff. So they would be in this process. This is not a practitioners driven process, by the way. So it's a process which requires a variety of skill sets. So for mental health, you require people who expertise in mental health, mindfulness, yoga, etc., to guide you. You require dietitians to help you prepare and guide food as per your own individual situations. You require health coaches who can guide you in the entire process, and obviously there is Dr. Gaurang Ramesh to manage and administer the entire process. So it requires a team effort, and therefore we don't have a consultation oriented approach. We rather have a program centric approach which works on personalized treatment, education, and also this transparent community. Is this clear to all? Can I move forward? Yes or no? Perfect. Thank you. Now, the first step is that we need to obviously understand you. The moment you enroll into our program, if you do, then we ask you to fill up a detailed history form. So I'll just share with you what kind of form this would be. 1 second. Okay, so it's a very, very detailed form. This is the form that would be given to you. Okay, so we obviously ask the basic details. It's a very lengthy thing. I'll just run through this. So all kinds of medicines, what kind of conditions and symptoms that you have been having, what time period you have had these birth control pills or antibiotics and other things which are potentially going to have lead to these problems, different kinds of infections and the frequency of it, all different kinds of symptoms, etc., and again the frequency of it, plus additional symptoms, small little issues such as sore throat and nasal itching. All of this can be correlated into the root cause, what we exactly have to test. So we need to understand, we can't go blindly for 10,000 different kinds of tests. In order to clinically understand you, we need to understand what is going on with you, right? So all of these different things we take in terms of your medical history, different kinds of lifestyle choices that you have, and so on. Then the next section. All right, got it. So all of this is there. So different kinds of allergies and different kinds of conditions that you might have been having. Then we also understand about your lifestyle and your diet, the kind of things that you do in terms of your exercises, the frequency of it, your stress, your sleep cycle, all of this, your mental health has to be understood. The kind of good and bad things you have been consuming, for what duration and frequency, fruits you eat, all of these things, candies, sweets, what kind of cravings you have, all of this is a signal of the kind of infections potentially you may be having. Okay, in fact we also take your specific dietary choices so that we can design the diet and nutrition as per your own choices, whichever part of the world you are from. Okay, so all of this goes in. Plus we also take your metabolic assessment, meaning the kind of metabolic health you are having, the kind of motions that you are able to pass, the kind of dependencies you have on different kind of let's say medications, and all of these different small, relatively small issues and small manifestations of the underlying issues. So we take all this history and basis that your what kind of tests you need to run, that would be decided. Okay, so the moment you join in, you fill up this detailed history form, you share all your test reports, diagnosis, and all prescriptions that you have done in the past for your condition. We study all that, and basis that we help you understand what kind of specialized lab tests you need to conduct. Now, what are the lab tests? I'm going to discuss in a little while. So once the results are there in place, we get into an exploratory call with Dr. Gaurang Ramesh. So whatever has been missed, for example, or whatever we have collected in terms of the entire data set that we have compiled together, basis that you have a long discussion, half an hour discussion with Dr. Gaurang Ramesh at least, within which your treatment plan is prepared basis your root causes. So we help you understand what are the reasons that you are having underlying, what are the things we need to correct, what kind of time frame it would take for you specifically, and what are the results that we are expecting within this 3-month period. Potentially all the conditions that we have discussed, most of them are treatable within this 3 to 4 month period that we have discussed. Okay, so now to talk about the tests. Now this part is understood very clearly. Should I move forward, yes or no? All right. Okay, so now about the tests. There are 3 types of tests which potentially could be there. So I'll talk about the cost and all of those things. Dr. Gorang, if I'm incorrect somewhere, so please correct me. So there would be a comprehensive blood test which would help us understand about organ functioning, about hormones, about nutrition, and about inflammatory markers, which would be mostly required. Now, most of the assessment basis that form would be done clinically and along with your discussion, right? So most assessment would be clinically done by Dr. Gaurang, but to validate some of the things, these particular tests could be required, right? So cost of this test would be approximately around 8 to 10,000. The first comprehensive blood test, depending upon who requires it, right? The second test it would be gut dysbiosis. Now, in order to test some of the infections, sometimes in around 10 to 15% cases, a gut dysbiosis test might be required. This helps us understand about a variety of things about leaky gut, about infections, about dysbiosis, and about different kinds of detox pathways as well. Cost of this test is around 4,000 rupees. This test is done through a kit. So you receive a kit at your home, and in that you have to drop a couple of drops of blood and a couple of drops of urine, and the reverse courier guy comes and picks up that particular sample from your home. It takes about 8 to 10 days to basically test and come up with the reports. All right. So the test is done in a very similar manner to how people do it for diabetes. So there is a team who would guide you how to do it on your own. All right. So this is the second test. And sometimes, very, very rarely, in some rare cases, a gut microbiome test could be required. Dr. Garang, are you there, sir?
Yes, yes. Yeah.
So please correct me if, about the cost, sir. This test is about the first one.
Yeah, see, basically, it's not. It all depends on what the person is suffering from, whether the person already has previous reports, and how old the previous reports are, and all that. So based on that, we decide what you need. So usually, we need to assess all the metabolic inflammatory markers and the nutritional deficiencies. So that is why we need a comprehensive blood test. So that if you look at the packages which the labs have these days, it comes up to around 8 to 9,000.
Right. All right. So this is required, and so these are the tests which could be potentially required. So depending upon your health condition. All right. So is this understood clearly? Can I move forward? The gut dysbiosis test, Vandana, is 4K. All right, perfect. Now, implementation. So obviously there is a complex, we'll talk about this later again, Vandana, after the question answers are over. Right? So the personalized diet. So obviously people need to follow a particular diet, and the diet is going to be very, very different for all individuals, and it has to be potentially changed uh, after a few weeks or within a few weeks and so on. So there has to be individual guidance and individual assistance. So there is a dietitian in the program which will assist you in exactly that. Then comes exercises, yoga, and mindfulness. So it is extremely important to take care of mental health during this treatment period of about 3 months, so that this 5 hour could be implemented successfully. So there are separate sessions on yoga and mindfulness that you would be having, so that the team can guide you or the person can guide you individually. How do you take care of your stress, your anxiety, and your mental health during this treatment period? All right, but the main way in which we would be controlling and reversing your conditions is through precision supplements and medication. So medication could be required in some cases where infections are at play, or in certain specific cases where functional issues can be dealt better through medication. But in most cases we are relying on supplements. Now supplements, we are trying to, in order to minimize the costs, we are trying to go towards and also increase efficacy. We are trying to go towards, some of the supplements could be pharmaceutical grade. The idea is that the cost and also the results would be much, much faster, so that all of this could be achieved within a 3 month period, right? So supplements typically would cost you around 2 to 3 thousand rupees per month, or lesser than that, maybe 1 to 2 thousand rupees, depending upon what individual requires, including medication, right? And you would have direct access to Dr. Gaurang through and throughout. There are going to be a bunch of educational sessions. The group that you would be a part of is also administered by Dr. Gaurang, and you would also have a clinic number wherein the entire team would be accessible to you through and throughout. There has to be continuously tracked and monitored. So for that, there are health coaches separately who would stay in touch with you and keep monitoring your progress and your condition. All right. So is this understood? All right. So at the end of the day, the consultations are 1:1. We also have a sustenance advisory towards the end, what you need to do beyond this 3 month period, so that the conditions do not come back to you. So certain observation may be required for 1 or 2 months or 3 months, depending upon who is in what situation. Continuous WhatsApp group support and education and community is always maintained. All right. So now, just to summarize the entire thing, we have these 4 charts, the guidance of what has to be done at specific point, different kinds of recipes, and how do you account for your progress, that would be guided through different documents and different procedural steps. So there would be team who would be letting you through time and again through this entire process. In order to execute, there would be educational sessions by Dr. Gaurang, as well as Dr. Gorang would be there, part of the WhatsApp group, to guide you in whatever challenges you are having intermittently, as well as the consultations with Dr. Gorang directly, right? So in terms of support, there is a dietitian, there is a health coach, there is also a yoga person, yoga and mindfulness person, which has been missed here, and plus community and direct support. And plus, obviously, there is a community for your responses and queries. Now, we would be having these educational sessions which happen bi-weekly. So every second week, there would be an educational session taken by Dr. Gora. So these are the topics of these educational sessions. And plus, there would be 6 mental health sessions on yoga and mindfulness by the expert. All right. So is this understood? All of this is understood very clearly. Yes or no? Can I proceed further towards the main important part, which is basically the costs? So I've started a small little poll. Please make sure that you respond to that poll as well. And after that, we'll pick up all the questions that you have, right? All of these sessions are live. These are interactive. These are approximately 1 hour session. All of them would happen at 8 p.m. in the evening, right? And the recordings and what you need to do and the guidance, etc., would all be shared with you. All these conditions that you can see at the top of this slide, all of these conditions is what we are going to deal with and what we are going to potentially resolve within this 3-month period. Plus, you would be able to understand how to control your mood, your mental health, what kind of diets would work for you at what point of time, and how do you relate to your food, what kind of relationship you need to develop with your food. Plus, many other things would be shared with you, which would be guiding you throughout the process. Now, the cost. The cost of this entire process, all services that I have told you, Dr. Gorang, educational sessions, yoga practices, all of these different experts who would be working with you on an individual basis, the cost of this individual program for a 3-month period is 16,000 for one person. Okay, so this is a reduced cost of 20,000. If you want to join in for more than one person, for two people, the cost is 24 from the same family, etc. And if you want to join in for more, it is 30,000. For every additional member after 3 people, it would be 5,000 more. So that's the cost of the program for an individual. Now, if you want to join in for educational purposes, wherein all these group sessions, whether it is for yoga or whether it is for learning purposes, if you have any minor issues, right, a little bit of acidity, a little bit of bloating, a little bit of not clearly identified health challenge which you have been suffering from years together, then in that case, educational program is good enough for you. You don't have to spend massively. But then in most cases where the challenges like IBS or IBD or serious chronic gastritis, etc., is there, then in those cases, it is advised that you go for a full individual treatment program. So cost for this educational is 7,000. The first educational session is going to happen on 14th of December on Thursdays. So all the sessions would be happening on Thursdays at 8 p.m. every second week. Okay, so this is how it is. The details of how to enroll and all those things we'll be sharing within the group. Now I'll stop myself here and we'll start with the discussions. So please make sure that you have raised your hands and all that so that we can organize this better. Mr. Surajit, you had a question. Please go ahead, sir. Mr. Surajit, if you are there, please go ahead. Okay. Mr. Partho, please go ahead if you're there.
Where will these tests will undergo? I think which diagnostic center?
Hello.
Yes.
The blood tests in any of the labs close to your place, a good lab like Metropolis or SRL and those kind of labs can do the blood tests. But the other tests, which is the dysbiosis assessment, the urine metabolite test, and the microbiome test, there are only two labs in India which are doing now. They'll usually send you the kit to your house, and you'll have to send the sample back to them.
Okay, in that case, I don't have to go there, na?
No. For the blood test close to your house, they will come and pick up the sample from your house. But the other test, stool microbiome, they'll send you a kit. You don't have to go anywhere. From the house itself, you can send the sample back to them.
Okay, sir.
All right. Mr. Surjit, are you there? Do you have a question?
We finished Surjit's. Mr. Surjit says that.
Surjit didn't ask. Veenuji, please go ahead. Miss Veenu, you had a question, ma'am?
Yeah, I wanted to know about the complete microbiome test. Because you did not elaborate on that. So what is it
So
exactly?
there are about 3 labs in India which are doing it now, but the lab which has the highest experience now in who have been analyzing the US data and all that is the Buckspeaks test, which is again send the stool microbiome stool sample back to them.
And how much does it cost, sir?
I think 9.5 to 10,000 rupees. I think.
Okay. And another thing that I wanted to know was like I'm suffering from food allergies.
Yeah.
So, according to you, that is basically because of leaky gut.
Correct. So it's also because of the imbalance between the good and the bad bacteria, which is the dysbiosis. That many times there are few nutrients, especially the complex carbohydrates, which our enzymes don't digest. We need the bacterial support to digest it. So when that is not happening properly, or the bacteria is producing a lot of excess gas with those food items, then that's when you start developing symptoms. So there are some diagnosis which you don't have the enzyme itself. For example, lactose intolerance. But many times when you develop after you're an adult, it is not a genetic problem. It is an acquired problem. So it's usually because of these two problems: the microbiome and the gut lining.
So, sir, do these allergies get resolved completely?
Yeah, see, the one of the main trigger is the environment also. So, environmental trigger allergies, the response of which your body responds is definitely reduces. So, the amount of duration you're suffering, that will 100% come down. But allergies, you can never say for sure that you are cured of an allergy, because it can also be environmental. But
So
food
basic,
allergies,
yeah,
food
food
allergies
allergy.
definitely you can cure if you have developed it in your adulthood.
Yeah, so basically they have been developed in the adulthood only. And
Yeah.
how long, sir, does it take to get out of this, the food allergies?
Yeah, initially we'll have to, the healing process takes about 1.5, 2 months. And the third month we start introducing the foods. So then many times 50% you'll be able to accept it. And then sometimes some foods you need more time. But you should keep a minimum duration of 3 months, a maximum of 6 months.
Okay, okay. And then another thing, sir, wanted to know was for these food allergies, so supplements and all these things are also given, right?
Yeah, some supplements are, speed up the process.
To speed up the process. Okay. And the you were talking about the yoga sessions and other mindfulness sessions. So are they also common or are they one to one? Because so many times we do have issues like we are not able to do certain asanas or we have a different problem. So are these mindful sessions, how are they?
Yeah, see, basically, if some emotional conflicts have to be resolved in a proper way, sometimes one-on-one sessions are required. But when we're doing it in a group for 3 months, it's not possible to do one-on-one session as a part of this program.
Okay, so these will be like general mindfulness sessions and
Correct.
things like
Yeah.
that.
Yeah.
They will not be one to one.
Yeah. General mindfulness.
Okay, thank you, sir.
Thank you.
Right. Thanks, ma'am. So Surajit, I think you couldn't ask your question. If you're there, please go ahead. Okay. Mr. Murtaza, you had a question. Please go ahead. Mr. Murtaza.
Yeah, good evening, doctor.
Good evening.
Hello,
Go ahead, sir. You are audible.
I am audible. I am audible there.
Yes,
Yes, sir.
yes.
You are audible. Please go ahead.
Yeah, sir. Actually, I'm a paramedic and I'm working with Indian Air Force, and I suffered this H. pylori. In from 2019, I'm suffering this H. pylori infection, and mostly in our Indian gastrologists, they have the problem that they relate this problem with the with the mind, with the mind, with the mind. Basically, they have only a single tool, triple therapy. They don't, maximum people don't know about the quadruple therapy. Later on, as a
Yeah.
parent, I used to Google a lot of things, and I came to know after 1.5 years there is a quadruple therapy also, which is not available in everywhere in India. Later on, I took the quadruple therapy. My symptoms are very less compared to older. I was in a mood to have a suicidal thoughts and like that because this infection is really very terrible. Once the person gets infection, people used to call that we have a psychiatric issues and all. Now, my only question to you is not, I have done 3 endoscopies in 1.5 years, which is itself is a big challenge going through the endoscopy procedure. Now, my only present scenario is that I am having some candida infection on my mouth, and there is the GERD is there and little symptoms of here. Sir, can you tell me where from you are practicing so that I can practically come and can get treatment from there?
Yeah. So, like I was telling in the seminar, so basically triple therapy might decrease the load of the bacteria. But what we need to do after that is also create an environment in the stomach so that the bacteria doesn't come back, and whatever bacteria is left over also is suppressed. So for that, we need to look at 4 aspects. One is the good bacteria, which can also suppress the H. pylori, like Lactobacillus reuteri, rhamnosus. These are the ones which work in the stomach and it will suppress the bacteria. So that we will be starting has a tablet, and then we'll teach you how to make curd and ferment it make it a
Yeah,
part of your diet also. So that for
thank
a longer time it can keep suppressing the H. pylori. The second aspect,
yeah.
whatever damage is done in the stomach, that is the inflammation that has to be treated. So, unless the bicarbonate layer in the stomach doesn't come back to normal, your stomach is still sensitive. So that is why we need to use some nutrients like zinc carnosine and L-glutamine and aloe vera, which will help you get that inner lining of the stomach back to normal. And third is you're saying that the throat issues. So one is that it can be because of the reflux. Second is it can be because of the yeast overgrowth also. So the yeast overgrowth happens because of excessive antibiotics. We have taken triple therapy multiple times, and triple therapy is a pretty powerful antibiotic also. So that is why we need to treat the yeast overgrowth. Also, we can use natural things like neem and turmeric and some good bacteria and all that. But we can decide based on your history, we have to go a little deeper into your history, whether you need medicines for that. Or we can do it naturally with some recipes. And then we also have to look at the intestinal health with some bifidobacter strains of good bacteria. So when we do this 4 things, when we incorporate, then you don't get a H. pylori again. And
Sir, only
in
I'm just
fact, we can also use some components of quadruple therapy like bismuth and licorice and mastic gum and all that.
only sir, the problem is with the Indian doctor is that please they don't take it. Otherwise, they don't understand the problem. Even we have a good gastroenterologist. I'm from Jammu and Kashmir. We have very good gastroenterologist there. He used to call my parents that he's having a mind problem. But this is a problem that this should be addressed in the higher level also. You people going the meetings and all, just tell them this is the problem. Patient is having a problem. That is why patient
Correct. I totally
level.
understand.
That's what
All right, sir. So the team would connect and guide further. Please go through the information we have shared in the group already.
Okay, sir. Just last question is that I want to the consult doctor. Is he available there in any hospital in India? I just want to visit the doctor.
So we have an online program. The consultations happen through video calls. So the doctor is accessible and available everywhere. And it's not a touch and feel kind of analysis that one needs to do. There are some tests and clinical understanding by talking to the
That I
patient. Also, the
that I will go, sir.
that we have.
The-
So you can avail his services from wherever you are, sir. You don't have to travel.
Okay, sure. Thank you a lot.
All right. Mr. Surjit, once more, do you have a question? If you're there, please go ahead. Otherwise, Mr. Prasanna, please go ahead, sir.
Hi, doctor. Good evening.
Hi, good evening.
Yes, sir. Go ahead.
Actually, I am suffering from multiple ulcer before 2 month, 3 month. Actually, I have taken almost 50 to 60 antibiotic they have given us, and now the symptoms are reduced, but still I am facing some issue like mucus in the stools. I want to know whether it can be curable. Yeah, it is not. And
Yeah.
also,
So when you
the
say
doctor
ulcers,
has
is it in the stomach or in the intestine? Is it small
it is
intestine?
in
large
the
intestine?
intestine, small intestine and big intestine.
Okay, so most of the time it is an infectious disease which progresses to an inflammatory disease. Okay, so I definitely have to go deeper into your blood test to see if it is what exactly the diagnosis is. So there are two reasons why the treatment may not be working. One is there it may be an infectious disease which is being treated as an inflammatory disease. Okay, or the infection has progressed to an extent where it has become an inflammatory disease, but you're being still treated as an infectious disease. And abdominal tuberculosis is one of the things which can be missed, and we directly jump into IBD diagnosis. And some of the IBD markers can still be positive in abdominal tuberculosis. So I need to go a little more deeper into your reports to first get the diagnosis, and then we can come into the now treatment. If it is an infectious disease, then definitely over the next 2-3 months you will be able to get rid of it. But if it has become an inflammatory disease, then it'll take longer. But definitely doing this approach will give you more advantage than just following medicines, because if it's an inflammatory disease, medicines will only control your symptoms. But what we're trying to do is balance your immune system and support your gut to heal also, with all the nutrition and the good bacteria and all that. So whatever your diagnosis is, definitely you will benefit from it, but the timeline will be varying. That's all. Infection will get rid in 3 months. Inflammatory will take longer.
But they have tested everything, tuberculosis and everything will get negative. And also they have done the biopsy also, but that also comes negative. And they went to do another type of colonoscopy in next 15 days or something else they told us. So what you suggest? Can I do that? Yeah, I will join your program. And
you can join the program definitely, but also you can do the colonoscopy, because we will not miss inflammatory disease. We can catch it in a colonoscopy. Okay, so if you get a diagnosis in colonoscopy, then even if it is an inflammatory disease, we can still help you.
but it can be curable, right? Yeah, it cannot be.
Inflammatory disease, you have to think about it like a remission, right? So if the causes of the disease or your environment or the diet or something triggers, then there is a small chance that the inflammation can come back again. But the chances for it to go into remission and absolutely going into no symptom phase is possible.
Okay. Okay. Thank you.
Thank you.
All right. So, Mr. Vinay, please go ahead, sir. Mr. Vinay Chotrani. Vinay sir, आप red mic button unmute.
Hello.
Ji sir.
Sir, I am still suffering from intestine gases. Dr. Preetinanda Simbal has treated me, But as you know, she has given me the probiotic, which was not working for me. So now I am not taking any medicines. I am just taking supplements of only leaky gut care, vitamin B complex, and magnesium. Apart from this, I am not taking anything. But the problem is I am not getting now sufficient sleep in the night. So when my sleep timings have changed, I have to take antidepressants for the sleep, which I am taking since last 5 to 6 years. The antidepressants are Altonil plus 5 mg and Escazid LS. Both I am taking, but what is the problem is happening when I am taking the antidepressants also? The problem is that the gases are elevating from the intestine due to anxiety disorders. The gases are elevating into the previously it used to elevate in the brain, causing causes of brain fog. But now, since I am practicing meditation and humming exercises, and as well as I chant Aum, so they have reduced now anxiety symptoms. They are just coming up to the chest levels or sometimes to the throat, to the esophagus, causing little bit of acid reflux. But apart from that, I am having all the sleep problems. I cannot sleep because every now and then in the sleep, I have to drink lot of water to elevate the gases. So I go for urinate. When I go for urination, my sleep cycle gets break out, and I can merely sleep for 5 hours. That also not peacefully. That is the problem now I am facing. But when I am taking the thyroid medicine, I get the motion. But apart from this, when I'm not getting the not taking the thyroid medicine, I am not getting the motion in the morning. Only I pass in the night 30 to 40 times gases. While I wake up and go to the washroom for urination, I pass gases. All the gas problem is there. Because of the gas, the fear is also there. Because of fear, the fear and flight mode gets activated again and again, and so that fear, because of the fear and flight mode is getting activated now. So I have reduced it by doing some meditations, and there's Aum chanting and other exercises also I am doing. Some say Vegas now exercises also I am doing to remove the IBS. But Dr. Preeti Nanda Symbol told me you are suffering from small intestine bacterial overgrowth. So she gave me that fish oil, omega-3 fatty acids. As soon as I took that, first she gave me probiotics, and that probiotics didn't work for me at all. That probiotics caused me lot of gases. Even the gases increased by threefold of a time. Now the gases are little bit less, but when I am taking the probiotics, the gases are increasing enormously. And now when I take the thyroid medicine, I relieve from the gases as well as from the constipation. I am suffering from hypothyroidism. That was detected in the test which Ayush told me to do it, which Pritinanda Symbol also told me to do it. So I have done that test also. And that test, after giving the IBS treatment, she told me you are suffering from small intestine bacterial overgrowth. Whereas
Yeah,
it doesn't.
I got the idea of your problem, sir. You have realized that it's quite a long-term problem which needs detailed evaluation. But to put it on a short solution for you, so that is why I mentioned that we need to go from top to bottom. So we can't directly give a probiotic unless we create the ideal environment for it to survive. That is one thing. Second is, we need to make sure all the other factors which are contributing for you, like the thyroid issue and the motility issue and the reflux and the enzymes deficiency, these are addressed first. Once these are addressed, then we need to support your gut. See, the anxiety and the sleep disturbance, what you're feeling is because of the microbial toxins, small intestinal bacterial overgrowth, and also because those bacteria are not letting your neurotransmitters which are important for sleep, like the serotonin, produce. So that is why we need to give your body those those amino acids, which will help you secrete those neurotransmitters directly. So what you're taking as medicines are like symptomatic treatment. So from that, we should gradually transition to amino acids, which will help your serotonin pathway function well. By then, when we support your gut with the enzymes, with the amino acids, and with the nutrients, then you'll start improving slowly, and then your dysbiosis will get better. And once you start tolerating the good bacteria from food or from supplements, then you can stay in remission for a long time.
Sir, but what is happening? I'm getting, when I'm introducing new food now, I'm getting food anxiety and other types of anxiety, constipation anxiety. When I'm thinking about that, the anxiety gets created. Food anxiety, sleep anxiety, and other types of anxiety disorders have developed in my brain, in my say what you call as subconscious mind. Alexa, stop. In my subconscious mind, they have created autonomic nervous system, autonomic press system, whereas they automatically, when a thought creates, it automatically gets evaluated. So I suffer from this stress and anxiety. What happens? This stress, fear of mind gets elevated. Flight and fear mode always gets elevated. Now also, when I was talking to you, this acid reflux symptoms is not there. She is giving me this betaine HCl. I am taking it. So when the gases are evaluating now from the intestine because of this fear and flight mode, only that time some little bit acid reflux happens. Otherwise, I am taking three.
Sorry to cut you, Vinayji. In the interest of time and other people, if you can keep it short, sir, please.
Okay, no issues. I will. I am taking three betaine HCl while eating food in the afternoon as well as in the night also. Three.
Yeah, so if in your condition it's not possible for me to simplify the advice and give it a general advice to you, we'll have to go a little deeper. We'll get on a call and then we can discuss and see what additional stuff you can do to make your healing process faster and more ideal. So, like I said, I feel the missing link, if I have to immediately tell you, is the hormonal health and the amino acids which are required to produce the serotonin and the neurotransmitters which relax your body. So those nutrients, once you start giving the body, then your body will start relaxing and your healing process will become faster.
Sir, one thing I want to ask, one question only. I will close it out. But why so many gases are creating in the night and resulting in drinking lot of water and going to washroom again and again? Why the
See, basically, over the whole day, whatever food you eat, the undigested food, the bacteria starts acting on them, and it gets piled up by the evening and night. So that's why you're experiencing more symptoms in the night, and during the night, some of the bad bacterial load will reduce because you're not eating, and then you are okay in the morning. So the food is creating the symptoms by the end of the night. So
sir, my whole cycle has got disturbed. I am eating breakfast at 5 o'clock. My lunch is at 7 o'clock.
Sorry to cut you. We'll have to move further, sir. I'll set up a separate discussion between yourself and the doctor, etc., and take it further offline. Please,
Okay,
sir.
When you will be having this discussion with?
Drop me a note, sir. We'll connect.
After?
I mean, drop me a note, drop me a message or call me. You have my number.
Oh, yeah, I have your number. Okay,
right.
okay, no
Mr.
issues.
Suji, you had a question, sir. Please go ahead.
Can I visit doctor's chamber? I am suffering from IBS and IBD from 5 years.
IBS and IBD.
IBS doctor says that IBS. I visit the Dr. Rupa Banerjee EIG.
Right. So
But
for IBS, sir, we don't have to travel or anything. You don't have to go to the doctor in his chamber and all that. We have this video consultations and we have a very extensive process you might have missed maybe. So we collect all information about your health through this form and we collect certain diagnostics and all that. So basis that we are able to determine, and we have these video consultations and there are a bunch of different, so it's not a doctor's driven process. It requires a yoga and mindfulness expert for your mental health. It requires a dietitian, it requires a health coach. So it's an integrated method which will help you come out of IBS. So for that, we have a program designed which does not require you to travel. All right. I think Surjit is not there. Miss Rabia, please go ahead. You had a question, I suppose. Miss Rabia? Rabia is not there. Mr. Tushar, you had a question, sir.
Yes, sir. Hello, doctor.
Hello.
Yeah, so I clean my bowel 2 to 3 times a day, right? And those are normal, but only smelly. But still my breath, that smell like a poop always, right? So like a stool smell. So what can be the reason, and is it curable with your program?
Can you just repeat the last sentence?
Okay, that smell. Okay, so my breath that has a smell like my stool at poop.
Mm-hmm.
Even though I clean my bowel 2 to 3 times a day, and those are normal, only those stools are smelly, but my breath always smell like a poo.
Yeah.
What can be the
So
reason?
this is because of a gas called either hydrogen sulfide or methane. So these two gases are foul smelling, which are produced by the bacteria in the gut. And it's usually because of the imbalance in the upper part of the small intestine, in the duodenum, in the jejunum region, where this bacteria is producing these gases. Like I told you, the way we diagnose, the dig-in approach of diagnosis and the 5R approach of the treatment will definitely solve your issue with that. We have to go deeper into identifying what bacteria is it. Is it a food intolerance? Is it a enzyme deficiency which is causing that gas production? The problem is the gas production, but we need to find the reason for the gas production. Right, so we need to see, is it enzyme deficiency, or is it food intolerance, or is it microbiome imbalance, and then correct that problem.
Okay. And the cost that you have mentioned is 16,000, so that is only the program cost. So it will have the test plus supplements, so those will be extra, right?
Correct. Yeah, so it's not a general test for everybody. It's not the same supplements for everybody. So based on your problem and requirement, we'll decide.
And one last question. So the test that you have mentioned, don't we have to carry it out, your expert centers or authorized center by you, or can it be done by any local center and just we can share the result with you?
Yeah. The blood test can be done in a local, a good lab in your city, and you can send us the reports. But the other tests that has to be done, there are only 2-3 labs in India which do it. So that details will give you where to do it, and they will send the kit to your house and get it.
Okay, got it. Thank you so much.
Thank you.
Miss Vandana, you had a question. Please go ahead.
Yeah, thank you. Thanks for the session, first of all. I think it was very informative. So I have some issues I'm dealing with right now. I think part of it is contributed by the fact that this was a difficult year for me. I've had about 3 to 4 losses in the family. We lost people. So after that, I found that I'm having a lot of difficulty with my digestion. So couple of questions that I had was, one is the 16,000 that is to sign up for the course. It's 8 to 10,000 for the blood test, 4,000 for the next test. And then there was that third test that I don't know if I missed or It wasn't mentioned. What was
The
the
thing
cause?
is, you don't have to worry too much about the test because our intake process is very detailed. So a lot of
Okay.
information we can get based on your symptoms, based on your history, and when your symptoms started, and that itself can give a lot of clues to the diagnosis. So
Okay.
we can work with many times without the tests also. So the tests
Okay.
are required only for few people who we need to advanced evaluation. But when the symptoms are straightforward and we get an answer based on your history, we don't need additional tests.
Okay. So since it was a rough year, I have had to be supportive of many family members and have practically lived in the hospital for about 2 years. I could not afford to be a patient myself. So whenever I would struggle, I was being advised to take Pantodac and all that so that I could continue to function, and give the support that was required. Anyway, we have come through that phase now. I need to address my health. My sister, who did not attend this workshop, experienced some of the things that was brought up, like rashes and all that. So can she sign up for this without having sat through the what do you call this, the workshop,
Yeah,
the 2 hour workshop?
yes, she can. No problem.
She can. Okay. And my quick question is, I have a doubt whether I actually have less acid, and maybe all these Pantodacs are further reducing the acid. So will that be tested in any of these tests you mentioned to know what is my acid level in the gut?
Yeah, so I'll take this opportunity to share this also. So basically, like I said, we need to differentiate between acid reflux and gastritis. Gastritis is
Right.
inflammation in the lining of the stomach, but reflux can sometimes be with gastritis or maybe without gastritis. So
Got
to
it.
differentiate that, you can just take 2 spoons of apple cider vinegar, mix it with half glass of water, and take it in empty stomach. So if
Okay.
you feel comfortable after that, that means that you had low stomach acid issue and you don't have a gastritis issue. But if that apple cider vinegar creates pain or burning sensation or discomfort, that means your stomach lining is inflamed. So,
Okay. So if it's pain, it is inflammation, right?
correct, yeah. So we
And
need
if
to
it
read
is
the
no
stomach.
pain,
Yeah, if there's no pain, then it's a low acid issue, which
low
is
acid.
causing the reflux. Yeah.
And
So
you said 2 spoons of ACV in half glass of water,
yeah, and take it empty stomach.
empty stomach. Now, if I do have pain, it means there's inflammation, but then I'm back to square one feeling sick. Is
Yeah,
there
then
anything I can?
no, you have to. I mean, we can first treat the gastritis. Give nutrients to for the stomach lining to heal, like L-glutamine, zinc, carnosine, and all that, and then start supplementing the acid. Then the reflux will come down.
No. You said when you take the 2 spoons of ACV, there will be pain if there is underlying inflammation.
Yeah,
Now,
then you
if I do that test,
have to
if I
take an
do that test at home
Yeah,
and
you
I
have to
do
take
have
an
pain,
antacid.
what
Antacid.
should I do? What should I
Pantoprazole
do?
antacid. Pantoprazole antacid you can take.
Take that. Okay,
Yeah.
okay. And I hope you don't mind my asking. Lastly, can I get some information about the organization that Yellow Squash organization, and some basic information about the people, the doctors, credentials, and everything else?
The
Please
team will
don't take this
connect
the
and
wrong way.
ma'am, the team will connect and share. By the way, I am one of the co-founders.
Right.
So we basically, in general, we are into 4 categories. So one is digestive health, other is child-related issues. So it should contain also autism and ADHD and so on. Third is metabolic health, and fourth and final is infertility. So these are the 4 categories that we have, and we have associations, partnerships, and empanelment with different specialists with different uh, many of these conditions separately. So separate programs we run so that holistically the entire thing could be done. We have been operative for about 3 years now,
Right.
and altogether across the programs and all that, we have handled or we have taken. I mean, as the program is, so around 10 to 11,000 people, around 11,000 people across 46 countries have participated so far.
Okay. And do you have a website with all the
Yeah.
credentials?
All of this is already shared in the group.
Okay, okay. Yeah, I guess that was it. So we have about 2 days to get back to you. And one of the reasons I'm asking is my sister just went through cancer. She came through it and came through the treatment. So if I have to talk to her, I just want to know where I can show her some information about you as a group or group of doctors. That's why.
We have shared the credentials and obviously we'll share more.
Okay. And is there a phone number, the same WhatsApp group? I can reach out to you on whatever phone number that
Numbers
is?
are being shared. I basically, for this program at the moment, I'm sharing my number so people can reach out to me directly.
And your name, if you don't mind, once again?
Ayush.
Ayush. Okay. Thank you so much. That's it from me. Thank you.
Right. So, Mr. Robin, you had a question. Please go ahead.
Good evening, sir.
Good evening.
I have a problem of ulcerative colitis. It's diagnosed in the month of April this year only. So I want to just ask this. I have not a very big issue. I have a main problem is diarrhea. I have to go to the washroom around 6 to 7 times a day. The main problem is that approximately 4 times in the morning from 6 to 9 and rest in the evening. So is it possible to? Is it curable or not? First of all, this thing, please, I want to know.
Yeah, see, basically ulcerative colitis, if you take in the normal gastroenterology definition, it is not a disease which is considered curable because it is an autoimmune disease. And if a small trigger is there for your immune system, then you can get back the inflammation. Okay, that is about the normal definition of ulcerative colitis. But when we do this along with the allopathy approach, so in regular treatment, we give you immunomodulators, we give you anti-inflammatory medications locally and through the tablets. So along with that, when we do this whole 5R approach, then we radically improve the chances of your remission. Remission is when you don't have any symptoms. Okay, you're passing 1 or 2 times a day stools. You don't have loose stools, no blood in stools, no symptoms at all. So the chances to stay in remission, that is symptom free, radically increases with this approach. Okay, so we definitely have a lot of cases. I have been practicing this functional medicine since the 3 years of where I shifted from normal gastroenterology to functional medicine. And the oldest patient is still, they were all patients of UC patients who were fit for surgery, that we had to do colectomy in the normal classification. But who have not undergone surgery and staying with very, very minimal drugs till now. So we have that kind of cases, a lot of cases, but we cannot promise that it's a cure because it's an autoimmune disease. We should call it remission, that you are symptom free for the longest period of time.
The time, can you tell me the time definition, the longer time, how can it can be, how much time it can be longer?
There are success stories of even 20, 25 years because the functional medicine itself is a new branch, right? So even the senior practitioners are about 20 years experience now. And even they have published some case studies of having symptom-free ulcerative colitis for 20 years, 25 years. When you get relapses also, it will just be some loose stools and just few streaks of blood. But within few days, you get back to normal stools, even if you get the symptoms back. So that way you can stay for a long time, you can stay symptom-free.
Okay. How much time is going to be take to come to the normal stool and the normal, if I start with your medication?
In your case, based on your symptoms, what you mentioned, I definitely have to go through the fecal calprotectin and the sigmoidoscopy report to grade your ulcerative colitis and tell you a proper answer. But based on what you told, I think 3 months is a good time for you to go into remission.
calprotectin test is 9090. I have just done 2 days back.
Then you shouldn't take more than 2 months.
Okay. And can you give me, can you tell me about the food also? I can eat every food, or I have to take the decision what I have to eat or not, like I am doing in these days.
See, the problem with IBD is it's a little complicated because even fiber, which feeds the good bacteria, when it stays for a long time in the rectum, it can irritate the ulcerative colitis area and cause inflammation. So it has to be a low residue diet. At the same time, you should feed the bacteria. So to go into remission, we start with a very basic diet, like an elemental diet and cooked vegetables and all that. And then once you get into remission, you'll be able to tolerate most of the foods. It won't be a very restrictive diet.
After remission, I can eat most of the food, right?
Most of the foods, yeah.
Thank you very much.
Thank you.
Mr. Jitendra, you had a question?
Yes, sir. Good evening.
Good evening.
Sir, I was facing the problem of back pain and neck pain from the last 2 years, but I have problem with my stomach too. But I haven't gone through any test for the stomach. I have gone through the multiple tests for the back pains. But I'm connecting the dots that there is a problem in my stomach. So I am passing the stools in a day. Used to pass the stools 2 to 3 times or 6 times sometimes. So it might be the possibilities that my issue of the neck pain and back pain because of my stomach.
Yeah, definitely. Like I told you about the intestinal permeability, that's how problems in the stomach can translate to other parts of the body and cause bone pain and myalgias and muscle pains and neck pains and all that. So definitely your stomach issues can be related to the neck pain and back pain. And also many times in situations where we many times miss a chronic constipation, mistaking it to a diarrhea, because when the stools are formed a hard mass in your descending colon and your sigmoid colon, the colon is trying to produce water, and that water will come out as little loose stools multiple times a day. So that's why we need to properly evaluate you and see whether it is a proper diarrheal IBS or is it constipation, which has then become mixed type of IBS. So once we get that diagnosis, your symptoms will quickly we can resolve.
For that, sir, what kind of diagnosis should I go through?
Just a simple abdominal X-ray also will give us an information. Along with that, we need to spend time analyzing your history and your symptoms and all that. That form which we send, that will give us a lot of information. Along with that, a simple abdominal X-ray will tell us if there is stasis of stools in your colon.
Okay, sir.
Hello.
Hello.
Yeah, Sumana here.
Yeah, please tell me.
Yeah, sir, can I'm talking with the doctor, sir?
Yeah, I'm Dr. Gaurav.
Go ahead.
Yeah, I was listening to your talk. So almost since 5 to 6 years, I'm facing this gut issues. The first time I have diagnosed with H. pylori bacteria, and after that I have taken they have given some kit for antibiotics for 14 days. And after that they asked me to do some few tests, and it was negative. They told nothing to worry. But since that time, my stomach issues, like right side stomach burning, that pain is passing towards the thighs sometime, and sometimes stomach issues will be there, sometimes it will be all right. Like this kind of issues I'm facing since almost since 5 6 years. And nowadays, like if I eat anything outside, for example chat or anything, something like that, it's other than my home food, so I'll have loose stools. I don't know, like I have done all the tests, like even what is gut microbiome test and stool test, whatever tests are there, all the tests I have done. everything is normal. I'm not able to diagnose my stomach issues, sir.
Yeah, ma'am. So the yours problem is like I was telling, it's a case of long-standing H. pylori, which is the bacterial load might have reduced because of the antibiotics, but your stomach is not fully healed. And the protective layer in the stomach, which is the bicarbonate layer, also might not have fully healed. That's why you're reacting to outside food when you eat. Immediately, your stomach is, the motility is increasing, your stomach is getting irritated, and the diarrhea is happening. So that definitely we have to first look at if the H. pylori is still there. We can just do a stool test. A blood test will not be accurate in your case because you had the infection once. So a stool H. pylori antigen test will know whether you have an active infection now. So based on that, we can decide how aggressive we should be. Whether to aggressively treat the H. pylori again with bismuth and some herbs and mastic gum and licorice and all that, and then treat the fiber approach we can do. Or if the stool H. pylori antigen is negative, then we can directly go ahead with the fiber approach. And we can, there are some certain fermented curds made out of lactobacillus reuteri, rhamnosus, and all that. That will help you create an environment in the stomach where H. pylori will reduce, and also the stomach will start recovering.
Okay, sir.
Definitely,
Even I got it done, the GI map test, I got it done. And I think enough tests I have done, sir. I can give one big list actually. That
Yeah,
many.
we can go through your tests and we can make a plan. That shouldn't be a problem for your condition.
Okay, sir. Is it related to IBS or IBD or something like that, what you're talking? Or whatever the issue I'm facing is different, sir?
Again, IBD is something which it doesn't seem like in your symptoms, but to confirm, definitely we need a confirmation of fecal calprotectin and the blood test. But IBS is something which, like I said, doesn't have any meaning in terms of the definition. Because if you just have some symptoms and we're not able to find the reason, we call it IBS. So you, based on that, you fit into IBS. But it's curable. It's not something that it's we cannot manage.
Okay, sir. Yeah, thank you, sir. Yeah.
Ms. Fida, you had a question, Fida?
Hello.
Yes,
yeah, go ahead, ma'am.
Hello. Yeah. So my problem is with my gas buildup. Like I've never done any tests regarding this, but then the thing is that, say I'm late for my meals, especially breakfast. By late, I mean like 30 minutes late, and my gas will start to build up, and I suffer for minimum 2 days. I get headaches, and then I start to diarrhea, and then I want to know how to go about this so that I can, I don't want to keep taking Pantop every time this happens.
Yeah, so
you said it's over the counter medicine.
Yeah, so like I told you in the seminar about the diagnosis of your problem. So we need to look at all the functions. Is it a digestive issue where your digestive enzymes are not getting produced enough? See, basically, gas is what the bacteria is fermenting the food which is not digested properly by your enzymes, and the bacteria is producing is responsible to produce the gas. So it can be a digestive enzyme issue, or it can be a bad bacterial issue, or it can be a motility issue where the intestines are moving very slow. So once we, with a detailed history of your symptoms and your medical history, we reach this functional diagnosis of the digestive enzyme, microbiome, and motility. Then we can definitely step by step correct and then reverse this problem. You may not need a lot of advanced tests. Just a simple detailed history might give us some good amount of information to help you out.
All right. So, because I'm from Meghalaya and I want to join your program, is that possible?
Yeah.
Yes,
So
yes.
we don't. It's a completely online program. So wherever you are, you can definitely do.
All right. All right. So I also keep having a fungal infection, a yeast infection. That could
Yeah.
also be related to my.
Yeast overgrowth is one of the reasons why you get bloated. That's creating the gas also. So and yeast overgrowth in the gut communicates with the skin microbiome. So when you have yeast overgrowth in the gut, the chances of getting skin infections also increases. So definitely that's interconnected.
All right. All right. Thank you then.
Thank you. Thank you.
Right, Lijo, please.
Sir, can you hear me?
Yes, yeah, go ahead, please.
Sir, I have a gas problem from right side main. Sometime in left side, sometime constipation and loose motion, sometime normal. I am already in sonography and endoscopy and thyroid test already trying, but that test is normal. That doctor has told that IBS. Already I'm in 2 or 3 months eating probiotic tablet and gastric tablet, but don't change my problem.
Yeah, like I mentioned, your problem may not be diagnosed by usual endoscopies and scans because structurally you do not have any issue. But definitely, when we go deeper into your history and your symptoms, we first, like I was talking about the previous person, that we need to know whether it is a long-standing constipation which you are experiencing, which you're mistaken as a diarrhea because the colon is trying to produce water to get rid of the constipation. So that diagnosis we need to make, and once that is done, we can do that with a simple X-ray also. Then we will be able to make a plan for you.
Okay.
Okay. So
Morning time, lot of gas producing in stomach, sir. And sometimes in right side in sound, gulula sound, and back pain, and stress.
So definitely your problem sounds like it's constipation, but it is mistaken as a mixed IBS. So we can just confirm that with an X-ray and then sort out your problem.
Okay. Already I am trying endoscopy and colonoscopy, not trying. Endoscopy and sonography is over. Thyroid test is all normal, sir.
Yeah. How old are you?
I am 29.
Yeah, you may not need a colonoscopy. We can just manage with the regular simple test itself.
Oh, colonoscopy, okay.
Colonoscopy is not required, a simple test is enough.
Okay. Then how to ready, sir, that problem?
Yeah, that we need to go a little more detailed into your whole history because we need to understand what triggered the issue first. Was it an infection which did not recover fully? Many of the IBSs is a gastroenteritis where you don't recover fully and you continue to have some problems. It can be even a viral problem post-COVID and those kind of issues, or it can be a travel related issue. So we need to understand the history fully once you fill the form, and then we can make a plan. But the steps involved in the treatment remains the same for you also.
Hello.
Right, sir.
Hello.
You are audible, Lijo.
Okay. Sir, right. That is sure is IBS.
Yeah, like I said, we are trying to find the cause or the dysfunction in the body, which we call it IBS. See, IBS itself is just the main term given for symptoms. So we're trying to go a little deeper and understand why is it causing the symptoms? Why is it IBS?
Okay. 2 years old that problem. I am 2 years before not eating, regular eating and not exercise.
Yeah. So all those things can play a role. So we can go in detail of your history and we can find a solution definitely.
Okay, okay, thank you, sir. Okay.
Thank you.
Sadalgi ji, please go ahead.
Hello, sir. Can I talk to doctor, please?
Yeah, I'm Dr. Gaura. Please
Yeah,
go ahead.
sir. Sir, actually, it is for me and for my wife. Both are right now. We are, under a remission. My wife has got a Crohn's disease, which was diagnosed in 2011. Underwent strictureplasty, and she has got strictures in small intestine, and it is narrowed, and effective length of the intestine is reduced. And she is, sometimes comes out of remission, comes out. When she comes out of remission, then she takes only the Azoran and SARS. But when it is in the effective this thing, when it is not in a remission mode, then some sort of steroids also given. Then again comes back. Then we are in the same thing. It is a circle going on. So right now she's in remission, but in the remission also hemoglobin comes down. At least every 3 months, 6 to 8 comes down. Again, we have to give the treatment like NC carb 500 mg IV injection.
Yes, sir. So what happens is, yeah, please go ahead. You can finish it.
So that is the vicious circle going on. So, but we are right now, she's on the remission and taking treatment like only the SARS and Azeron. SARS 500 mg twice daily, 2 times, and then Azeron 75 mg. So how will you go about for her?
Yeah, so if you are asymptomatic with SARS and Azoran, that means you definitely she has an opportunity to improve and go into remission fully, because so what is happening in her case is the inflammation control is happening where she is being asymptomatic, but the intestinal lining is not completely getting healed where her absorption becomes normal. So that's why her nutritional deficiencies are continuing. And that nutritional deficiencies is again causing her a risk to develop the disease again. So that is why we need to support her intestinal lining recovery first, with some nutrients which doesn't have to get absorbed, but if it just passes through the intestines, it will help it heal. Like I mentioned, aloe vera, L-glutamine and all that. And then give her nutrients, identify the nutritional deficiencies, and then give her the nutrients. And once that she starts healing, she can definitely go reduce Azoran and SARS gradually. But it will take time. It might take a year also to completely get off her medicines. But I think it's possible because she's not on major medicines.
Yeah, it's correct. And for me, I am actually having a GERD problem because I had the acid reflux. And then doctor gastroenterologist told to do the endoscopy. We did the endoscopy, and there was H. pylori infection. He gave for that treatment, triple treatment for 14 days. That is cured. And then afterwards, again one more endoscopy is done. It is there was a lot of in the stomach as well as in the duodenum. There's ulcers were there. That all cured now. In the second this thing endoscopy is cured. I'm also in remission, but I'm still taking 20 mg that PPI.
Yeah, so yours is a typical case of PPI dependence where your stomach lining function has not got back to normal, but you are comfortable with a PPI. So for you, first step is we have to identify if there is any residual H. pylori infection. It can happen over 1 or 2 years after finishing the H. pylori treatment, it can come back. So we need to rule that out first. And if that is clear, then we can go step by step. First, give the nutrients for your stomach lining to heal, and then create an environment where H. pylori doesn't come back. And then start supplementing your enzymes also. Once your enzymes are supplemented and your gas and everything reduces, then your reflux will reduce and it will become much easier for you to get off PPI. Slowly taper off the PPI.
So for testing H. pylori, is there any oral, test instead of doing the endoscopy?
Yeah, the oral breath test, urease breath test is available, but it's not easily available in smaller hospitals. You need to go to major gastroenterology centers.
No, we are in.
What you can do in normal labs is stool antigen test. Stool H. pylori antigen test can be done.
Okay. So stool antigen, or we can breath UBD also. UBT.
Correct.
So UBT, if we find out, that will be how is the efficiency of that, whether it is a good marker or it is a
Stool,
very.
the sensitivity of stool test is better than the urease breath test.
Okay. So stool test, what did you mention, sir? Stool test. What
Stool
did
antigen, H. pylori stool antigen test.
Stool antigen test. And then other time you mentioned to one lady, to find out whether it is acid problem or GERD problem. There's some eating, drinking in the morning with a low stomach, in an empty stomach.
Correct.
What is that test actually? That can
Yeah,
home
then
we can do.
we have to know whether your stomach is healed, but your acid production has not got back to normal. If your stomach is healed, then your apple cider vinegar, you can tolerate it. But if your acid production is still not up to the mark, if your stomach is not yet healed, then your apple cider vinegar you cannot tolerate.
So the apple cider test will tell what is the problem.
Yeah, it will differentiate whether your stomach is inflamed or not.
Okay, not the stomach lining problem.
Yeah, correct. Stomach lining, whether it is inflamed or not, it will tell us. The apple cider vinegar will tell us.
So that if you do the test, if it is pains only, it is a acid problem. In sense, the stomach
Lining
problem.
of the gut problem. Yeah, the inflammation in the lining of the gut. Yeah.
Oh, thank you, sir.
Thank you.
Mr. Amit, please go ahead. Mr. Amit Chaudhary, you had a question.
Yes, sir. Thank you so much. It has been a wonderful session and very knowledgeable. So thank you so much for that, sir.
Thank you, sir. Thank you.
Sir, I have a query with regards to ADHD brain-related symptoms in a child. Sir, basically, the key issues are related to stimming, a delay in speech, and there are therapies which are going on. There is heavy metals, yeast overgrowth, and constipation. Sir, if I broadly have to ask you, I was listening intently in terms of just the sequentially you handle things, as well as you mentioned very categorically regarding this, that you handle both the issues simultaneously, because there would be signals going from gut to brain and brain to gut, and it would be 9 times more from gut. So it has to be healed from there, but at the same time, you attack the problem both ways. But like there would be things that we would hear about, things like that give kefir, it gives good bacteria, it would help overcome bad bacteria. But then some would say do not do that initially, or there would be issue of probiotics or high fiber. So sir, when we know about these issues, which would be the broad things which should be consumed besides the treatment, which is a no-go territory? Like at what stage you can go for things like kefir or any other probiotics? Is it okay to consume them? Even if that may be milk kefir, that may be coconut kefir, that may be water kefir, whatever is safest, or it is a no-go. So it will help if
So
you
the only issue with kefir is the yeast. So when you have an yeast overgrowth, even a slight fermented yeast wild strains can stimulate symptoms to the child.
Right,
So,
sir.
So unless you have evidence of clearing out that yeast overgrowth and the child developing tolerance for the fermented drinks, kefir is risky. So a safer bet would be to grow lactobacillus strains, bifidobacter strains, and the bacterial strains in home cultures and then give the child instead of just giving wild cultures, because kefir, when you even if you take the foundation of kefir to make at home, you don't know what is growing, and it's always has yeast.
Got it, sir.
It's
So,
safer bet to start with bacteria and then progress to yeast.
sir, when you said home culture, these strains like lactobacillus, are you pointing towards something like curd, or because sometimes you go for gluten-free, casein-free diet, so it
Yeah.
is.
So if casein has a problem, then a coconut fermentation would be better. If casein is not tolerated well, then you can go with A2 milk. You can still make it bacterial-based curds.
Okay, sir. So coconut fermentation is first preference, and then A2 milk using that.
Yeah.
And it would be culture would be coconut kefir grains, or it would be something else
No,
using.
again, kefir grains will have yeast.
Got
Without
it. Got it.
grains, you don't know what it is. So,
So,
bacterial capsules, what you get in the pharmacy, can be used.
okay, got it, sir. And sir, like constipation, that also recurs. So, but you say it may be for n number of reasons. But
Yeah.
are there some safe things like something like the trifla as a syrup, or some people would recommend very mild castor oil, or there would be n number of other things, and the quantity of liquid or water which would be ingested, because you would go for Shri Dhanya grains, millet grains, which would again constipate.
With all due respect, in the interest of time, with a long list of 15 people remaining, so we do cover these things and much more in the educational plan that we have, sir. Maybe you can consider that. Otherwise, these things are something which probably we can take offline, and I can have a long discussion, or my team
Sir,
can have.
I would come to just the key points. I assume I would still have some time left. I would try to keep it brief. I have seen much detailed discussions earlier. I would appreciate if some time can be given to me. Can I go ahead, sir? Hello.
Yeah, please go ahead.
Yeah, thank you, sir. Sir, okay, I'll just say that I heard a particular patient talking about the symptoms and giving details. So listening to that and you giving feedback based on that was very good to hear, sir. But when it comes to a child, and especially ADHD child, then you would not get the feedback in terms of from the person himself per se. It would be based on diagnosis, and more than diagnosis, all the extensive tests. So, sir, would that be a substantial limiting factor, or we would be good to go and look at a time frame of 3 to 6 months for addressing all these issues? What is your just take on that, sir? Honest.
Yeah, like you mentioned, that is definitely a limiting factor. But over time, once you have the information of the test, parent
Yes.
actually develops the knack of looking at the symptoms and assessing that. So that's why the Celosquash also has a program with Dr. Ashwani, who deals with autistic kids. So he is well versed with dealing with and explaining to you all the symptoms you can catch with a child, and you gradually develop the knack of seeing whether the child is intolerant to something. I personally am not. I don't have experience, a lot of experience with pediatric population. Although with dysbiosis I can still manage, but autism and ADHD, I'm not an expert in that.
Okay. It would be with Dr. Ashwini Garg, but sir, in terms of different sessions with some experts, because regarding just the dysbiosis and other things, the information you gave, it was very confidence boosting. So would we have the opportunity to get some inputs or one of those sessions with you also, or some kind of input?
So this what Ayush was mentioning, the educational program, is when I go through the whole process of identifying the dysfunction based on symptoms, and then looking at the enzymes, and then looking at the immune system, microbiome, correcting dysbiosis. So that is the 6 sessions what we'll be covering. And each of them will be 2 hours each, so that's a pretty intense.
No, appreciate. Great, sir. Just one last question. Means when we go for that program and going for that treatment in terms of sequentially addressing them, if in there would be some inputs and the program would be laid out, would if 1 month or 2 months down the line in between, if would there be some inputs that we can seek from you, that okay, this is the progress, and maybe just out of some of those personalized sessions, one of them coming from you as well as a second or additional input from gut perspective, because those in informations and inputs today were quite profound. I try to read, and I learned a lot in addition to whatever little I knew.
Sir, with due respect, we have to move forward.
Fine, Ayush. Thank you.
Dr. Sanjeevni, please go ahead.
Yeah, good evening, doctor. Actually, me and my husband, both of us are listening to your seminar. Actually, he is having acidity and distension. What he feels that the gas is rising up from the abdomen and it goes up to the chest, and then there is a pressure on the chest. Can this issue be resolved with these micronutrients?
Yeah, definitely. So the thing is, the esophagus is not fit enough to handle acid and handle acidic content. So that is why when it comes up, you feel that burning and you feel that distension in the chest. So definitely with this approach of first identifying what's causing the reflux, and then step by step treating it will help GID within 1 month, definitely.
Also, he's having fat nodules like lipoma under his skin. So, is that anything related with the nutrients or something?
Yeah, so,
can it be reduced or can
yeah,
it disappear?
lipoma is something which, with the clear-cut mechanism of the exact mechanism of how microbiome is interacting with lipoma formation only in select individuals is not fully understood. There is a genetic predisposition also, but definitely the microbial imbalance we have seen in many patients causing increased lipoma formation. So that incidence of or the quantity of lipoma formation will definitely come down. But absolute cure from lipoma formation we cannot give, because there is some genetic predisposition also.
Also, like obesity problem is there, the weight is more. So can it